I thought we were supposed to be happy for our people and our patients when they got better. No matter if I get them better or somebody else gets them better, you know, I'm always excited when somebody it gets better. And I don't have to be the one that gets them better for me to
Just
say,
hey, if you can learn something from someone else, awesome.
right. So we got to learn from each other. And I don't understand the hostility between all the physicians, and why we're trying to cut each other.
Welcome to the Peptides and Longevity podcast. Each week, we'll dive into groundbreaking science, innovative therapies, and the future of health and longevity. Alongside visionary physicians and experts, we'll explore how peptides, cutting-edge medicine, and lifestyle strategies can redefine the way we age. Get ready to transform your health, optimize your vitality, and unlock the secrets to a longer, healthier life. Let's get started.
Hello, it's Dr. Kent Holtorp with another episode of the Peptide Summit. Today, we welcome Dr. Gordon Crozier. He's a big deal. We've had a lot of great people that have knowledge, but he's a leading medical practitioner, researcher, and lecturer in areas of integrative and functional medicine as it relates to cellular therapy. And people come from all over the world to see him. His knowledge base is truly incredible. His lectures just blow people away. So we're very happy to have you. Thanks for being on. I'll finish your bio, but really appreciate you taking the time.
Thank you. It's good to be here.
Great. He looks great too. At his practice, I think he treats like the sick of the sick, kind of, bring it on type clinic in Orlando, Florida. He's a pioneer in the research and application of peptide therapy, revolutionary therapy that stimulates cellular regrowth in systems. He's recognized as a country's leading authority in the emerging treatments, is highly sought after nationally and internationally. And I know he's a highly sought after speaker. He's a best-selling author. He's been featured on national TV, radio, journals, and medical publications. So we're so happy to have him. And he's going to talk today about inside secrets revealed with actual patient case studies. So we're going to hear basically about, true studies and what he did to get these patients better. And I imagine you're not the first stop for anyone, that they've been to many doctors.
So yeah, most of my clientele, most of my patients have been around the block. They've been to all the big name hospitals and research centers, and really had minimal results to no results. And some of them have been to 22 plus physicians in the past, and including some of them integrative medicines in the past.
Yeah.
And they can't get well. So I like the challenge, I guess, because, it's all about cellular health, as you were saying. It's all about the cell and how to repair the cell so you can help and heal the whole organ systems. So that's I like to kind of find what's actually triggering what.
And it sounds like you're really, like the house type, doctor, medical detective. And I know it really takes passion, and, you're tired. You go, oh, I'm sure you're hitting the research. I got to find out how I can help this woman.
Yeah. Exactly.
I think it's awesome. And that's what, being a doctor is.
Right.
That's not what it is now. Being a doctor now is an algorithm, and there you go. But I just love the fact that you do that. And you've been doing it a long time, and just a great knowledge, and so generous in sharing all your knowledge. So again, thank you. Do you have any favorite peptides?
Oh, wow.
I don't know. You use
favorite peptides. I use a lot of peptides, a lot.
It's kind of your favorite.
But really my favorite of all time is thymosin alpha-1. And I use it so routinely on myself and so many different patients. And I love what it does. And especially right now when we're worried about our immune systems and all that, it really helps to modulate that immune system so it won't overdrive it. And that's...
Can you talk a little more about the mechanism, like how it works, or compared to the other thymosins, or...
So thymosin alpha-1 actually is a modulator, and it helps to balance the Th1, Th2 pathways because you need some inflammation in your immune system, but you don't want it overdriven so that you actually will drive it into an autoimmune response. So that's why thymosin alpha 1 will work a lot of times with people with autoimmune diseases, which I use a ton of it in autoimmune diseases, because it helps dampen down that overdriven immune system. So it actually helps with every aspect of the immune systems and your natural killer cells. It'll modulate them, and it modulates them. It doesn't overdrive the natural killer cells. It just modulates them so that they will work correctly. And so I love it because it works so perfectly. And I've used it, they've actually been out of it several times recently because I think everybody's using it now. And actually, that's really helped a lot with my cancer patients because I get referrals from some of the cancer centers here in Florida for people that are undergoing chemotherapy that these doctors know that they're exposed. And so I add thymosin alpha 1 into that, and they don't end up with pneumonias and other diseases because of their chemotherapy.
I'll make a disclaimer. We're not saying it treats cancer.
No, it doesn't treat cancer.
But, but it's approved for cancer in other countries, but we're not saying it treats it. But it's interesting when you look at cancer relapse, it's basically the level of your natural killer cell function is going to determine your relapse level. So chemo destroys your immunity.
Yeah.
And then they do nothing about it. And the nice thing is that this will boost it. But, people think of, or they go, I got autoimmune. I don't want to boost my immunity. I think it's kind of like all or one, but it's like a teeter-totter,
Right.
And so it boosts the good immunity and lowers that inflammation and that autoimmunity. And, so that's great. I've been around tons of studies on it.
Yeah, there's tons of studies on it. It's been studied in over 70 countries. And that's why the cancer doctors around where I live here, even from the other coast, kind of refer patients because they
do. I mean, an
Yeah.
oncologist, like you try to give them anything and they go, don't touch my patient,
Well, I'm not going to without their approval. And I never do. We always talk beforehand.
They'll blame it,
Yeah. So they always talk to me beforehand. They'd say, I'm sending so-and-so patient. They had stem cell transplant for whatever disease like leukemia, multiple myeloma, something like that. They said, we know you can help with some of these things and boost them and help them. And we would like you to do that. Just let me know what you think. And then I would call them back after I evaluate them. And they said, I think that these modalities, including thymosin alpha 1, would be good. A lot of them never heard of thymosin alpha 1 before.
That's what I'm saying. I'm like, am I dreaming? They're actually oncologists will call and say, oh, can you see my patient? You say no. And you can send, like, at least my experience is they never want to read a study. They don't care.
Oh.
They look at the algorithm. And it's weird to me is that they don't even test like what chemo or whatever is the cancer most sensitive to. They just give their recipe,
Yeah, their recipe.
And then if, I'll give the patient here's some studies and they, no, you wouldn't read them, just don't do it. And so,
Well, they won't read them. I'll give them to them, but they just want me to give them the gist of what they say. So, it's up to us to read.
That's a step forward. Yeah. That's good.
So, yeah.
What are the ones do you like? What are the peptides you use a lot of?
Well, I use a ton of BPC 157. I use it both orally and injection because I see athletes too, because I lift weights. So I'm in the gym a lot. And so I have all the gym rats.
What is that? A gym? I've heard of that.
The gym rats?
I think I saw one a couple years ago.
So I like to work out. So that's kind of one of my things that I release. And so I use a lot of BPC 157, for a lot of these people that have strained muscles, strained tendons, it really helps them to recover from a lot of those things. And I love it because it works for that.
I think it's a double-edged sword because, and all these bodybuilders and things, they're way ahead of the curve in terms of their knowledge versus doctors. Like they know so much and they use it. So it's like, unfortunately, it can get thrown in with, it's for bodybuilders, that helping, and it just helps recovery,
Yeah.
but also boosts mitochondrial function, other things too. But yeah, it's like they find out what works, and then everyone goes, "Oh, it's a bodybuilder thing," or that's what like someone's doctor will say.
Yeah, that's what somebody else will say, right?
Yeah.
All right, so you're diving deep into peptides and longevity on this podcast, and we're right there with you. Integrative Peptides stands out, trusted by over 10,000 doctors to deliver real results for their patients. These premium peptides are your key to unlocking vitality, recovery, and a longer, stronger life. Visit integrativepeptides.com and use the code PODLIFE for 10% off your first order. Again, integrativepeptides.com. Use the code PODLIFE for 10% off. It's time to elevate your journey, starting now.
But that's awesome. And the kind of cases you see, everything from neurologic to hormonal, lung sears.
Lyme and Sears probably is 80% of my practice, Lyme and Sears. And because every single Lyme and Sears patient, they all end up with some type of autoimmune disease. So they all have some autoimmunity.
Oh man, I just love it because I've given lectures on that, and they're basically all shown to have, antibodies to the brain,
Right.
pituitary antibodies, hypothalamic antibodies. But, you need either a special test for like ones of the brain, or there is no test for the ones like to the hypothalamus and pituitary, only in research. But yeah, and they'll get, they'll go to the rheumatologist and get a diagnosis because they'll have a bunch of different antibodies, autoantibodies, and that where they come and go, and they'll get diagnosed with, mixed connective tissue disease, meaning, well, it's autoimmune, but we don't know what it is, or antiphospholipid syndrome. They say you're going to have it for life. Where I'm like, no, you won't. No. Yeah. And it is, these titers that just go up and down, and it goes along with it. And we've kind of changed. It sounds like you have too. And I started because I had Lyme, and I actually want to know why you kind of got into this. But I did antibiotics, just massive antibiotics, and it didn't work because my natural killer cell function was like 1.
Right.
And there was no immunity to kill it. So you could never, doesn't matter how much, antibiotics you give. But we've become really an immune modulatory sensor, and it works it's like all the labs you do that on, chronic fatigue syndrome, fibromyalgia, Lyme, Alzheimer's, autism, and yet, damn, everyone's immune system is thrashed. Toxins, the sear, it's just, it's bad. But yeah, kind of going backward, but interesting. What kind of got you into this crazy medicine?
Well, it was kind of really my own story and what happened to me. And I didn't even realize it until I was clinical faculty at the University of Kentucky, and I got sick. But I had always had undulating health ever since I was in the second grade. In the second grade, this is back before anybody knew about Lyme disease, I was bit by a tick in Minnesota, which is one of the hotbeds, and I suddenly couldn't read. So I had to be taught how to relearn how to read. I went from the top of my class to the bottom, being called a retard by everybody in my class because you could actually do that back then.
And how old were you?
I was in second grade, so I was, about 7, 8 years old.
And they, of course, say, okay, why would you all of a sudden regress?
Right. Why would you regress? Well, nobody tried to figure it out. Nobody
like, okay, yeah, go to rehab, whatever, yeah.
So I always had undulating health all my life. So I was clinical faculty. I was actually setting up rural women's health clinics throughout Tennessee, Kentucky, West Virginia, and Southern Ohio, and trying to help with rural clinical help to help people in these areas with their health. And it was difficult. It wasn't an easy go. But so that was my job primarily there at the university. And then we taught residents and all that stuff. But I got really sick. I was doing surgeries, and I had some residents with me, and I was teaching them some laparoscopic techniques, and we were starting to do robotics back then.
So you were a surgery resident?
Yeah, I was OBGYN.
OB. Okay.
So I did gynecological surgeries using the robots and, robotic surgeries. And so I taught the residents. And I started getting so much pain and I just kept moving forward. Yeah, I'm in a lot of pain, unbelievable pain. And I noticed I was kind of forgetting some things a little bit at that time. But what happened was I just started passing out for no reason at all. And I passed out a couple times in surgery. I went on medical disability, of course.
Yeah, it doesn't look good. That's not,
Yeah.
You don't want your surgeon doing that.
Yeah, but your surgeon passing out. So I went on medical. Nobody could figure it out.
There's arrhythmia or what?
No, I had no arrhythmias that they could find. I think it was really POTS. And I think the thing is that nobody really figured it out.
And then no one tries to figure it out as a problem.
So, so I began doing my own testing. So this is back in 2006, 2007. And so I started doing my own testing on myself, and I'm going like, oh my goodness, I have Lyme, Lyme disease. And oh my goodness, my inflammatory markers are really out of control. And so I started looking at my inflammatory markers, and I'm going like, wow, I've got something else, pushing down my immune system. I don't have an immune system. And so, I kind of figured it out on my own. And I kind of listened to some other, there wasn't a lot of Lyme doctors back then. There were a few, but, just trying to figure it out.
But would you also say that, I really think that, people say, oh, what specialty? It doesn't matter to you, but it matters what you learn after you're out.
Yes.
And it's just incredible. I really think you can look at old literature and be a better specialist in about 2 months than most specialties. Not surgery or something like that, but all these other ones, because they're just stuck, doing what they were taught in residency.
Yes.
And the only studies they only read the studies, they say they do, is a drug rep comes in, it's something new on the formulary. And I did have basically a paper on it, what doctors know, why, because people go, why doesn't my doctor know this? And in Annals of Internal Medicine, they found that doctors are practicing 20 years behind what's available in medical literature. They do not read medical literature, even though they say they do. And when they do, they may read the abstract, but they really don't. But even worse is that if you give a doctor here's 10 studies showing what you're doing is not the best treatment, they don't want to hear it. No, my patients are different. And, it's even got into the LA Times, the doctors that don't want to follow, they say they're evidence-based, but you give them the evidence and they go, no, I don't believe that one because it's not what I do. I don't believe that one.
Right.
And which is why you look at levels of evidence, basically you have to randomize, double-blind, placebo-controlled, then you got meta-analysis and single-blind and case studies, and then you have societal recommendations.
Yeah.
Which are the worst level of evidence. And what do most doctors go by? Oh, our, cardiology society, endocrine society says do this. It's the worst level because they don't change their opinion based on new evidence. They're basically, they have a position and they don't change no matter what comes out. It's frustrating, but you sound like you've got a good mix, good relationship with the standard docs.
I try, because, we have to, I've gone through it because I actually was reported to my board by a plastic surgeon who didn't believe that the breast implants that the woman I was seeing, she had breast implants. And I'm going, I've done everything for you. I swear it's your breast implants. I just go back to him and have him, see if they are, if you're
ask.
She went back and asked him, can my breast implants be making me sick? And he reported me to the board saying everything I was doing was a bunch of hoax and da-da-da-da. So, we all have to go through those fights. So because of that, I'm trying to make friends with my colleagues around here to let them know that this is a valid form of medicine. All I'm doing is reading research and seeing what can be applied to the human person so that they can live better, a better life. I don't say I can cure anybody. I don't say that I can make them totally well or heal them, but I can tell you, I can make you have a better life.
I like that.
So let's talk a little bit about Parkinson's. It's a lot of people go on a lot of Parkinson's meds. And this was a 74-year-old who was really on a lot of meds. and he'd been on them for a long time. Well, the longer they're on them, they really don't work very well. And that was his big complaint and why he came to me. So he came to me because, his meds really were not working well for him. He would take them, and 2 hours later, he'd start to get rigidity and cogwheeling, and he couldn't do it. But he was having problems focusing. He was always getting a little bit of depression, too. He was a very analytical guy. So he would put everything out and have everything very strategic. Every time he came to me, it says at this time, he had everything in 15-minute increments all day long for weeks on end. And, he expect me to look at all these graphs. And I'm like, oh my, a little bit over the top. But, he was a smart guy, very smart. He'd build a cockpit in his basement and all these things. But, he came in, he really wanted help because
I just think what he feels like. He just was a brilliant guy. And now he's just like frail, debilitated, can't,
Right.
But and they just give him meds and go away.
Okay, here's your meds, go away, and he had been to a lot of places, and I won't say some of the hospitals that I want to get.
Oh yeah, they go, I'm going to the Mayo Clinic. All right, I'll see you in a month.
Yeah. So, he came in, he did have some elevated inflammatory markers. His TGIF beta was elevated. He had inflammation. His C4A was elevated. He had, you were thinking, oh, does he have Sears? What does he have?
Yes, and I just want to mention those are inflammatory markers that most doctors will say, oh, inflammatory marker, C-reactive protein. And that's all they check, which we find isn't often elevated in these patients. But so these are different, more specific inflammatory markers.
Right. So they're inflammatory markers that I look at. I look at all the inflammatory markers. And,
And everything's inflammation. You look at all the diseases.
Exactly. And so that's what I find out with a lot of the Parkinson's patients is they have a lot of neuroinflammation. So they have neuroinflammation. So naturally, when you have neuroinflammation, nothing is really going to work quite correctly. So he had a lot of it. And in fact, his C4A was 1,960. I'm just looking at it right here. I pulled it up.
And what lab?
This is through Quest. Yeah, that's Quest. So the top end.
Do you have a problem getting that?
Now I am. This is a year and a half ago. So
It is like all the key tests. It's like natural killer cell function.
yes,
C4A, hemoglobin growth factor beta. Those are the three they screw up every time.
they always mess them up. And sometimes if I get when I got this back, this was a repeat because I said, oh, that's way too high. They didn't do something right. Let's do it again. So I said, let's draw it in our office because I can do that and they come and pick them up so that I can actually know that it was processed correctly.
Yeah, those have to be processed correctly. Yeah.
So we did it and it actually was the same. So I guess it was right.
Or it just funny. I went to Quest myself and the phlebotomist goes, oh, this is that doctor that writes for so many tests. Yeah. I'm like, oh yeah. And I heard he's really cute. But and then she goes, oh, let me send off your natural killer cell. I'll be right back. I'm like, okay, that's great. Came back no specimen receipt, Right. Anyway, that's a request, but they're all terrible.
Yeah, it doesn't matter what lab you use anymore. It's just, it's independent. So he was just desperate for something. His C-reactive protein was actually elevated too. It was 11.4. So, he had a high C-reactive protein. His homocysteine was 14. I'm just looking at his labs right now. I pulled them up. And so he had high inflammation, even on inflammatory markers that normal people look at, the normal physicians that don't look a little bit deeper. So, he just really wanted help. He wanted something. And, they've done lots of studies on glutathione and how it works. And we've all probably seen some Parkinson's patients. If you do an IV glutathione, they're pretty good immediately, but it's only going to last a very, very short period of time. So it's really not, it's not good, because we need something that's going to work a little bit better.
Yeah. And those IV studies were out a long time ago.
A long time ago.
Yeah, it's that old research. Yeah.
And it's old research.
And if you found giving NAC continuously to Parkinson's patients is beneficial, which converts to glutathione?
Yeah, well, I will do that because most people, the NAC, it's the cysteine component. So a lot of people, when you study most people, because I was doing amino acid profile on everybody, and you might ask,
Tests that you like.
so,
I'm gonna get into the tests you like later, just so you know.
oh, okay.
Okay.
Well, I use
love
local
the
ones.
I love to hear it. Yeah.
I try to use ones where their insurance is going to pay for it. So I will use amino acid profiles from Quest and LabCorp.
Well, just through standard.
So I'm doing through standard ones if I have to, but then I also use something called Vibrant of America. It's kind of probably one of my favorites. So
Vibrant of America. Okay.
yeah. So I use a lot of their testing for their environmental testing too. I always do amino acid profiles because if I'm going to be giving any peptides are amino acids in chains. So if you are short on amino acids, a lot of times those peptides are going to break up to provide the amino acid is actually needed in the body. And then you don't really get the full benefit. You might get some, but you're not going to get the full benefit of that peptide. So that's why I always do that. So I can actually optimize their full amino acid profile first, because, I think it's good for us to know, and I can't necessarily remember every time, oh yeah, that is a, 15 chain peptide and it has, leucine. Now I can't remember those. So I do look them up from time to time to make sure that if that person is deficient on amino acids, I want to make sure it's not one of the ones that I'm going to be giving in a peptide. So
is your thought that it will take it from the peptide?
yes.
And do you replace with amino acids, IV or orally?
Yes, I do. I will do it first IV wise and then do it orally.
Yeah.
So
I think that helps with everything. Yeah. And I think when we were talking before, how, we were talking about how the peptides are really synergistic with so many different therapies. And while they'll work on their own, but they basically, it's exponentially with every other treatment.
I think so. I think exactly that way.
Yeah. And I mentioned a doctor came to one of the conferences and talked about BPC 157 and said, oh my gosh, it makes everything work better. And I'd never met her. It was a Dr. Tringali who we're going to interview next. But yeah, she's like just in love with it. It just, it works great on its own, but even better when you use it with other therapies. Yeah,
exactly. And you can take that orally. It's very stabilized orally. I mean, most of them you're getting them stabilized to take orally. And that's what I love about what you do, is because you are actually going to the next level to actually help these things be stabilized for oral use. And that's what's so amazing about you. So
I think I could have retired, but the money we're spending.
yeah.
Stuff. But no, I love it too. It's kind of like, the researching and trying to make, better mousetrap.
Yeah. So, because he had such high inflammation, of course, I put him on oral regimes and I put him on oral therapy. He was on NAC, of course, but I also really did some IV therapies with him too, of amino acids and some other things, so that we could actually.
Like ozone?
I do like ozone. Mm-hmm.
Yeah, that's one of our mainstays. I think it goes along well with everything.
I think ozone works well with most treatment modalities, and I think it really augments a lot of them. So I love ozone. But I started him actually on thymosin alpha-1. It was the first one I started him on. And I started him on that first because of his inflammatory markers. I wanted to make sure we were modulating things. And just looking at, even his monocytes. Monocytes I look at for gut and bowel inflammation, because there's some evidence, you probably heard Dr. Lavelle talk about it many times, Jim Lavelle, that if your monocytes are over 7, you probably have some bowel inflammation. And so, and I look at that. I look at that on every single person, because there's a lot of people, they don't have bowel issues, but they might have a little bit of inflammation there. That little bit of inflammation in their bowels is going to make them not create some of the peptides that they they're
Oh, yeah.
serotonin,
So
you know,
connected.
it's so connected.
I mean, I even stopped doing like food sensitivity because they're positive on everything.
Yeah.
Everything, all these big proteins just coming through. It's
Yeah.
like on everyone.
Yes.
So all even pretty healthy people, it's all this, American diet and stress and whatever else, toxins, pesticides, everything.
Right.
But everyone's bowels messed up, and I think it's a big part of the whole vicious cycle.
Right. Right. So I started them on that thymosin alpha 1, but then I also put them on C-Lank and C-Max.
Can you talk about those?
I love C-Lank and C-Max. So C-Lank, it is a modulator. There's some evidence, I have an article that actually I had pulled up a couple weeks ago, and it was on how C-Lank affects GABA, but C-Lank also affects genetic expression for neurotransmitters. And I had not seen this article before, and it was way back from 2018. And I'm going like, why did I not see this article before?
Well, there's so many. I mean, just
Yeah, that's why I try to read at least 6 to 8 every morning. That's my morning routine. I'm going to read 6 to 8 articles.
You do every morning more than most doctors do in a year.
Yeah.
Just to let you know. I mean, that's totally true.
But you're falling behind if you don't. That's why I think. I don't want to. I still feel like I'm falling behind, and that's why putting things by you find different articles than I do, and so I have different people that can say, "Hey, have you seen this article? This is a great article about
I love that when people send me or patient finds something because I remember 15, 20 years ago. I remember it used to be like whoever you have to go to the library, find the journal, which often wasn't there, take it and stick it on the copy machine. Now it's information overload, right? There's so much you have to keep looking at all these services that, that's the problem of so many stuff thrown at me. It's like trying to take the time to go just sort through them even to see which ones you want to read. And if I were to pan over the stacks of journals that are my to read pile, it gets crazy. I'm sure
it does. It gets very crazy. And then trying to find out, then you spend this time reading this article and you found out, you figure it out. Oh my goodness, it's not even statistically significant. I spent all that time on that article and it's no good.
Yeah.
So
part of the gig.
So I like C-Lank because of that. And it also helps to increase bone-derived neurotropic factors. So, it's
between C-Lank and C-Max, they're both good for brain. I mean, I noticed that with C-Lank, like when I'm stressed, I was like, where's my C-Lank?
Right.
Yeah. And
there's a lot of evidence that it's an anti-anxiolytic. So, and I will use it on my patients that are overly anxious too. And it's very easy to use, just, nasal spray, just carry it around with you, put it in a nasal spray. But they say it work after it's out of the fridge. I don't know.
Yeah, and I don't think I've ever seen a side effect from them.
No.
Yeah.
No. I haven't got any.
Yeah, injection. We're working on oral, but
that's great.
Yeah, but I can't guarantee it absorbs yet. But when we can, I'll let you know.
Well, let me know. And C-Max, of course, as you know, it helps with dopamine and dopaminergic, that dopaminergic activity, which is part of the Parkinson's things because those dopamine receptors and they're not expressing enough dopamine and their dopamine receptors aren't working correctly. Well, C-Max.
That's the whole key, right?
Yeah, it's the key for Parkinson's. So I like those two simultaneously together because
and also dopamine for depression, motivation, all that. And cerebrolysine, I think you were using.
Yes. And actually, this guy did get cerebrolysine too, because I could get it back then. It's now we can't get cerebrolysine.
Okay, can you just explain what cerebrolysine is?
So cerebrolysine is actually a peptide that actually comes from pig brain, but it actually helps with the neural connections. So there's some theories that it actually helps with some of the enzymatic functions in the brain. So the enzymes are working correctly. The neural connections are developing and working correctly. And there's some articles actually on helping with neurofibrillary tangles as well. So, there's some good.
Goes along with Alzheimer's and
Right.
yeah, it increases connections. So in theory, it should make you smarter.
Right.
The more connections. And yeah, so recently the FDA said it's a biologic, but it will be available orally, which actually studies show it works through EEG studies showing it. So,
Well, that's great.
but I love cerebrolysine as well. It's been around forever.
Yeah.
And used in Europe as a standard therapy for Alzheimer's, traumatic brain injury, and anything neurologic. And we are so behind on all this stuff. And
Right.
I'm sure when you give lectures, it's like people go, why haven't I heard of this stuff?
Right.
And they've been around forever because they've been around forever and there's no patent on them. That's why you don't hear about them here,
Right. Right. And cerebrolysine was great. I used it on a couple of football players, ex-football players that actually had a lot of brain injury and brain trauma. We actually, we had some MRIs actually showing a difference in the brain volume before to after. And I used to use it in some old things. And then now I don't want to use them because the FDA doesn't want us to use it anymore, so I don't want them to think I'm using it.
It's like, hey, if it's safe and it works, they're going to try to take it away.
Yeah.
And I remember I was at a stem cell conference in Florida, and it was NIH, I think, and they just studied, they could tell what position the football player played, professional football player, by where the brain damage was.
Yes.
But you can reverse it.
Yeah. Yeah, and they're showing it, not just even by cerebrolysine, but there's other things.
Yeah.
Now there's so many things that are becoming tight for us to be able to even get, and then you're beginning to worry about all areas.
Scared of all the stuff's gonna be taken away. I'm thinking like, okay, what country do you want to move to, or why don't we all get together and buy a yacht? Park it 4 miles off the coast. We can do whatever we want.
I thought about that same thing. I thought, I could just, get a yacht and go 4 miles off the coast. And then I thought, well, it's a quick flight down there to Barbados. Maybe I could go to Barbados and,
Yeah, no,
it's made $250,000 to become a citizen of Barbados. So I can become a citizen.
Really?
Yeah.
All right. Maybe we get a 2 for 1.
Yeah.
I think I have a coupon.
There we go. So, I also did some other things with him because I really believe, just like in the Alzheimer patients, you need the proper fats for the brain. So I always give them phosphatidylcholine.
Oh, I love it. I love it.
And so phosphatidylcholine is one of my things that I use a lot of IV-wise, and I use a lot of it orally. And it helps a lot of these patients because almost every one of my patients has some kind of neurological insult. So that is
I like it better for chelation, getting rid of heavy metals, toxins. Yeah, I think it's great.
And I think it does a great job, and people tolerate being going under chelation better with phosphatidylcholine than with EDTA or DSMA.
Oh, yeah.
So, I think that they don't have to go under those harsh circumstances, and we still can get some great results. And I've actually found that for some of the environmental toxins, like Roundup, when I test somebody, everybody has Roundup in them, right?
Is it still on the market?
Yeah. So, but, I test a lot of those environmental toxins. But I find that phosphatidylcholine, really, I can get a good results of bringing those down very nicely with phosphatidylcholine, not any other agent, just phosphatidylcholine. Yeah. So that's why I really love it, because
I agree with you. And the studies on BPC 157, shows that it'll protect the body from numerous toxins. Mm-hmm. And even they did studies on alcohol, protect the liver from basically high liver enzymes, protect from overdose of medications, prevents a hangover too. Yeah. But mycotoxins, neurotoxins. So it's nice. It, prevents that damage from them.
Yeah.
We are bombarded with toxins. So it's like everyone should be on it, really.
Really. We all should be on BPC 157.
Yeah. And
I have my kids on it.
like, again, what's the downside? Well, you can say cost, it's not that expensive. You can do 1,000 times the dose. They can't find a toxic level.
Right. That's the nice thing about it, right? And that's the nice thing about a lot of these, a lot of the peptides. Nobody's ever been really, there's a few that, have some toxic issues with them, but I haven't found hardly any of them to really have any problems at all.
I've heard that to medication, any medication, I mean, over the counter antibiotics. I mean, or when you look at the studies on like TB4 or BPC, you can take 1,000 times a dose, no toxicity. Try that with anything, Tylenol. Try it with water.
Yeah.
We're gonna die. It's less toxic than water.
Yeah. Well, our water's pretty toxic. So he was ecstatic. So he actually, began to be able to move quite normally, really take him off any of his other medications.
And how long after kind of starting this stuff?
So he started feeling more aware and more cognitively, he felt like he was back about 2 weeks after starting everything. Wow. So 2 weeks. And really, when you began to look at his inflammatory markers came down. It took 3 months for his inflammatory markers to really come the whole way down to a normal range, but they came down. They were in the normal range. The last time I checked him, and
M11 to the CRP was 11 or something.
Yeah, 11.4. And he came down. Well, let me look back what he was 3 months out. He was still up there a little bit, but he was 6.2. But you know what he is today? Because I just saw him not too long ago. So I'm pulling up his labs here.
Hey, we know it's a actual patient.
I saw him 3 weeks ago. That's just 3 weeks ago. And his CRP was 0.4.
He's a man. I hear the man. I love it.
So it's great because, now it's a year and a half out and he has more of a life. He goes out with his wife. They walk every day. They do all kinds of things. They moved from New Jersey down to the Villages. So now he's actually
speak of the impact on his life.
Yeah.
Wow. What did the neurologist say?
Well, the neurologist was saying, this couldn't be. It's just chance. It's by chance.
So I would rather believe it's a miracle.
Yeah. So they said, your medication's just now started working. So make sure you keep taking his medal.
That's good. Yes. It usually takes 4 years to kick in. Yeah.
Now, I've had some patients that have gone back to their doctors with neurological issues, and they've gone back in there, and he said, oh, you're not using a cane to walk in here. And he said, I must have misdiagnosed you. And he walked out and never saw the patient again.
Oh, have you seen ALS patients at all?
Yes.
Yeah. So ALS patients come in, they're in a wheelchair, they're jogging, they go back to the neurologist. Oh, it must have been misdiagnosis, you know, and they'll never admit it was the treatment. Or one patient with a hurdle cell cancer, and her doctor was like, you have to get this taken out tomorrow. You're going to die.
Yeah.
And then she came and saw me and said, I think we can reverse it. I'm not saying what, but so give me 6 months. And we got the scan, the biopsy, it's gone. She goes back to her doctor, who she was very friendly with, and thought he'd be so excited. He wouldn't come out of the room and told the front desk to tell her she's no longer a patient.
I thought we were supposed to be happy for our people and our patients when they got better. No matter if I get them better or somebody else better. I'm always excited when it gets better. And I don't have to be the one that gets them better for me.
If you can learn something from someone else, awesome.
Right. So we got to learn from each other. And I don't understand the hostility between all the physicians, and why we're trying to cut each other's mouths.
But let's see, anything else? I'm gonna babble so long because I love hearing all your stuff. We're gonna go on forever. You want anything else with that one, or I'll move to the next one?
Let's move to the next one so we can get some people with some gut issues.
All right. Sounds good.
So I have, because of my own history with Crohn's, so I had Crohn's as well.
Oh,
not just
Throw that in the mix. Yeah.
Not just Lyme and mold, but I had Crohn's as well. And Hashimoto's.
Let me.
But so I get a lot of Crohn's patients just because in one of my books I talk about the Crohn's issue. So
Oh yeah, just back to the Parkinson's. Did you check for Lyme or anything with these?
I did because of his C4A being high and C3A being high. So he had both of them high. So I checked, all of his ACTH, MSH, ADH, they were all normal. His Western blot, but I don't go just totally on that. So, so we went to the IGenics route and I did that test and he was negative on that. So then I did some PCR. I did the PCR test too. And he was negative on all of that. So he did not have any Lyme, which I was kind of surprised because his wife has Lyme.
In fact, until proven otherwise. But yeah, you gotta.
He did have some environmental toxins, and I have to be honest, he did have some environmental toxins. They weren't the worst environmental toxins I've ever seen. I see healthy people that have that amount of environmental toxins.
Yeah, but again, it goes along with genes and on all the other stuff. Stress is huge, and what else? It's like if someone has Lyme, I think they're gonna be fine. But then you add on stress and mold and genetics, and But
yeah.
So it's just we're being bombarded, and it seems to me like, at parties or whatever, it's like everyone coming, I'm sick, my sister's sick,
Oh yeah,
everyone's sick.
Yes,
I
know. I went to a party the other night, and I was like, oh my, everybody's coming up to me. Oh, I need help. I've got this or I've got that, and I'm like, my goodness.
Did you get this though? Like, well, I should do this, or test this. No, my doctor says it's not it. I'm like, okay, how's that working for you? Okay. But
right, exactly. So this was one of my favorite patients. She was a 42-year-old female. She had 3 children, kind of real, she really wanted to be active. And she was on biologics, of course, like most Crohn's patients, they're all on some kind of biologic, but they weren't working for her.
Yeah.
And they were making her so fatigued. She says, I can't even enjoy playing with my children anymore because I'm so fatigued. Everything's out of whack with me. I just can't figure it out. I'm just tired all the time. And she actually, her father is a dentist around here, and her father had some patients that came to me. So that's how she ended up coming to me. And so she came in and really, all her numbers were perfect. And I'm like, I've not seen this before. My patients that are just coming in for anti-aging, I'm all like, they don't even have this good a number.
Yeah, like people say, what if you don't find anything as it hasn't happened yet? Yeah.
So I was just kind of shocked, how good her numbers were. But, her gastroenterologist had shared all the slides and, all the things. So she really did have Crohn's. Nothing was helping her with her Crohn's. And she was losing some weight and she did a lot of yoga. And she already ate pretty pristine, although she was Italian and she loved her pizza and her pastas. So she ate a lot of gluten, a lot. And I kind of addressed that right away where let's stop the gluten. Let's try to get gluten-free things because there's a lot out there that's available.
Everything. Good stuff. Yeah.
But it's hard for the Italians to do away with that. So she actually was in one of the local newspapers around here because of her story, which actually, was talking about peptides. So,
I was going to say congratulations, but you never know.
Yeah, well, I'm going like, oh my goodness, now I have a target on my back, right? So I was a little bit worried about that because she told her story, in this newspaper, and I was like, oh no, I really don't want this. I don't want that kind of publicity.
It's scary. You find this safe treatment that helped someone with a horrible illness, and first you think of, oh no, it's this, I don't know. The healthcare system in the world is.
Yeah. So, really, I started on BPC 157 right away, but I also did some thymosin alpha 1 because I really think that really helps with modulation of the immune system because, Crohn's it's really kind of an autoimmune process. So I always do that with my Crohn's patients or anybody with autoimmune. I'll put them on thymosin alpha 1. That's just what I do. It's
Yeah.
And so, she was on both of those from the get-go, from the beginning. And she really started getting some benefit. But I don't know if you've read any of the articles on how C-Lank actually helps with the healing of the gut as well. So I actually did put her on some C-Lank. And that's when I had some C-Lank that was, you didn't have to do it intranasally. You could actually give sub-Q injection of it. So we did sub-Q injections for C-Lank for her. And you know what? She came off all biologics because they weren't really helping her anyway.
Yeah.
And he was
another immune modulator. It's that immune
Yeah.
system.
Yeah. So I think it was primarily her immune system that really was out of balance and really causing that issue.
What was her human transferrin growth factor beta, C4A, natural killer cell function?
Her natural killer cells were great. They were normal. And so I was kind of surprised.
Right.
I was really surprised, but she was good. Her TGF beta was normal. C4A.
I would have bet money, someone with Crohn's but it's interesting, just a little kind of similar story with an 8-year-old girl that mom brought in. They tried everything, going to do a colectomy, said, and basically EPC 157, the TB4 fragment orally, and just dramatic change. And most of some stem cells are really, what are they now? Signaling cells and exosomes, which are what the decellularized
Decellularized growth factors.
Yeah. But dramatic improvement, right? So no longer need a colectomy. And then she went and had dinner with, actually trying to be my partner, and said, "Oh my God, we're so happy with this doctor that, they're going to do surgery on her. And he got her better." And he's like, my partner's like, "Is it Holtorf?" She goes, "Yeah, do you know him?" It's like, "Yeah, it's my partner." But, so it was funny, as a family friend of theirs, of his child. Yeah.
Well, that's great.
An 8-year-old, same to colectomy,
Yeah. Yeah. I have a little 11-year-old boy like that too right now. And he's so much better,
I imagine you treat autism.
Yeah. Yeah. So.
But don't the autism kids are just like the Sears, the Lyme, they have.
Yeah. And there's so much the same. So I have a story about that because my 22-year-old son was on the spectrum. He had the flapping hands. He couldn't look at you in the eye. He just really socially was very awkward. He's a very intelligent boy, but just socially was really, really awkward and really had a hard time. He went to go to college and he couldn't even go because he couldn't go into a classroom because he got so distraught and it was just, so it didn't even work out. So I paid for college for nothing. But yeah, I started treating him and, we got him a lot better. So, there's peptides. Those peptides work well for those. Those.
Yeah, and I like stem cells and the exosomes and the peptides are great. Yeah, I can tell you a bunch of stories of, kids where the mom sent in a video playing basketball. The basketball just went by him. And then we have to do them before anyone comes in because just throwing F-bombs like crazy. No one get near him. Now he comes in and goes, "Can I have a hug?" He's sarcastic. He gives his own thoughts, and they show him the gymnastics and actually playing basketball.
Yeah.
Pretty amazing. Yeah.
That's what, and that's like my son. Most people would look at him now and they said, "He's normal. He's normal. He's not the same kid he used to be. He is normal." And he actually is now working for 8 different doctors, and he's their medical assistant and he loves it. He likes to stay busy and, but he's out there. He's social. It's wonderful. So
that's awesome. That's great.
So she was doing great. Now, this is one story about her I want people to know. And I think it's really critical that people realize that they're going to have to pulse these things on and off the rest of their lives. They just got better. And then you walk out there and you're great. Because she did get decellularized growth factors as well. And, she did so well from that. Her bowel movements were normal. Everything was completely normal. She loved it. She felt great. She had more energy. She probably about 8 months to 9 months later, she started feeling bad and she didn't come back in right away. She didn't say anything. She just thought, oh, it's going to pass. It's going to pass. Well, then, before long, she starts getting worse. And then she comes in and it's like starting all over from scratch, where if you realize that this is going to be the thing, if you have BPC 157, you can take it all the time. But if you don't, or you can't afford to take it all the time, at least pulse it once you're better, because you're going to have to be on that on and off forever.
For whatever reason, for, the stress, genetics, the toxins are exposed to, mold, whatever they got going on. Yeah.
Well, yeah, and that's the reason. And when she came back in the second time, she had Sears markers that time. So she really did. And her genetics really showed that she had the HLA, where she really couldn't get rid of the mycotoxins well. So her mycotoxins were probably, we needed to bring them down, and we needed to, get those Sears.
What therapies do you like for getting rid of mycotoxins?
For mycotoxins, there's something I really like. It's called Mycobind, and it's by PHP. And
I like them. Yeah.
So that Mycobind, I see their results for their mycotoxins come down pretty dramatically, not right away, but over time. And I love that because of that. And I think that combined with phosphatidylcholine is kind of essential for bringing down those mycotoxins.
So, with the Mycobind, like, I think, like the cholestyramine, it's just so like it binds everything else, and it's such a hassle. Is it easier to take the Mycobind?
Yes. So the Mycobind, I don't think it's binding all the nutrients like the cholestyramine. So cholestyramine, a lot of that, my Sears patients never tolerated that. Say you put them on Welchol or cholestyramine, they were all the same. Nobody tolerated them. So I had to find something else. So,
there you go. Had to find it. Yeah.
When this came available, I was so ecstatic because I was actually asking for it for a long time. Like there was a couple other doctors asking for it too for quite a while. So I love it because it has the okra and the beet together, and it has that fiber component from both of them that is actually the proper electrical charge. So you have to have the right electron charge to actually pull those mycotoxins out, right? So people that are doing charcoals and stuff like that, they don't realize that the charcoal is actually the same charge as the mycotoxins. You're not actually pulling mycotoxins, you're pulling other toxins. So
I don't know. I'm just like, kind of amazed you're getting down to this, biochemical cellular level. And I'm just thinking, how many gastroenterologists talk about that?
Not too many. So, we did get her better again, but, it did take a little bit longer the second time around. She wasn't better in 3 weeks.
Did you ever check her house for mold or anything?
Yeah, I had her check her house. So immediately when she came back in and I realized, hey, you've had a mold exposure. Well, then I found out the whole thing is she was separated from husband. She moved out. She moved into a different place. So she had all this stress, a lot of stress. And then she had moved into a moldy apartment building. And I'm going like, this is what's going on. So you got to get out of there. You have to be in a safe place. Thank goodness you're renting this place. I always encourage everybody, if you're renting, have your house and have that place inspected before you move into it.
Yep. And I did up when and having some inspectors that it's, hard to find, are they going to, especially ones that do the remediation themselves, like, oh, there's mold everywhere, and what tests do you like for home?
For the home? Well, I use a guy, his name is John Bodie. He's an environmental guy. He does a lot of the government buildings as well, and he tests them for mycotoxins. So I use him for testing, but if I'm going to just test real, some people use the ERMI. I don't think that's so accurate always. There is something from real time where you can actually swab the filters in your furnaces, and you can actually send that off to see if you're having them floating out through the house, because a lot of these molds are behind the walls and you don't see them.
Yeah, I want to know what's out in the air.
But the gases are coming through, and it's really hard to test those gases. So everybody wants to test the mold that's out here in your room. You might not have mold. You're going to have the gases out here because the mold's probably behind the walls.
Good point. Good point.
So I want to know what the mycotoxins are in my house. And so I use the real time, I do that. I swab those from time to time. And then I have a friend who comes in and says,
I want to open a can of worms, but EMF, thoughts on that? Do you?
EMF? I put EMF blockers everywhere in my house.
Yeah, so I have a guy coming over tomorrow to our house and then kind of building a house, but and to check everything,
Yeah.
and like the builder let everything get moldy. He's like, "Oh, don't worry about it." I'm like, "No, I'm worried about it." I mean, you see black mold everywhere. So,
Yeah.
but that's a mold guy. But yeah, the EMFs where it either and I told a bunch of people like, "I'll just turn off your Wi-Fi at night." And people, I don't believe in that, but a couple people did it, and they're like, I slept better. And then, like, all of a sudden I didn't sleep, and I realized I didn't do it, and I didn't, and started sleeping better. So, I think it's another area. I just wait till 5G.
Right. I'm a little concerned about that, but our Wi-Fi turns off automatically every night in our house. And in fact, that's why I came to my office to do this. Because
Interesting. And it makes mold grow faster too.
yes, it does.
Yeah.
So now I do EMF blockers like on my laptop here. I have an EMF blocker on here.
What do you think those work? Like the little dots and things like that?
I'm not sure how well they work, but I feel better when I have them on. And I have one on my phone. I put them on my kids' phones. So I feel better when I have them on versus don't have them on. So I don't know how much of a thing that is, and I don't know how to actually study these things and test these things to see if they're really working or not. And so that's what I'd like to find the science on these things to see how.
I'll ask the guy tomorrow. He's like the man, supposedly, and
Yeah.
he's to come over and analyze our house and everything. So,
Well, when you find that out, you let me know because I don't have an answer on that stuff yet. Because
I'm going to ask him that. I didn't think to ask him that, but I'm going to ask him that.
I really haven't studied that enough. To be honest with you, I have some EMF patients, but most of them actually have mold.
It is. It goes together. Like they just get
Yeah.
sick, and where other people go, it's crazy because I'm fine and I'm in the, and I'm exposed. It's like you have, with mold, people, they're in the same house. It's like one person or whatever is the one that's sick because they have all the other stuff going on.
Right.
And I think it's all, and you were or vaccinations, who's going to get vaccination arm? You look at their immune system. If their immune
Right.
system is off, they are much more likely. I think it's kind of a marker and a cause, too, that whatever it is makes them much more prone. For instance, when I had Lyme, and if I had a flare, I'd be allergic to everything. And when I didn't, I wouldn't.
Yeah. Yeah, it's kind of strange how that goes, and I know when my mycotoxins levels are going up in my body, and I live in Florida, so, we're pretty humid out here. It's pretty humid. So, I have to be kind of careful, but I like to go over to the beach, kind of a lot. And you can tell because, I've got some sun on me because I go to the beach a lot, but I love the salt air. It just, it really cleanses.
Those negative ions, it's like,
Yeah.
or even in the shower, sort of think better. That's why I have a little notepad I stick because, all your great ideas are like in the shower, like, but then you forget when you get out,
Yeah.
Yeah, same at the beach. You just kind of clears your mind and you think better. But again, I'm babbling too much. So let's go on. I think we have the last one.
So I have two we could talk about. Either do another Crohn's patient or we could do this. I have a patient. He's interesting. He is why don't we do this one? He's a Tourette's. So a lot of people think, oh, Tourette's, well, he's a 44-year-old, he was a father of triplets. He was busy. He was always working. He was a hard worker. And so he didn't have Tourette's as a younger person. He really developed Tourette's around the age of 40. And it was just kind of suddenly. And so trying to figure out his history, it was really kind of difficult. But he started having some random jerks. So then he was a carpenter with his dad, and he couldn't really do the carpenter work anymore. And so he just started getting worse and worse and worse. And to the point where, he's making the grunts and the noises, and he can't control anything. But he also get
Self-consciousness and ability to work,
So, and then he started getting muscle rigidity. So he was from Alabama, and he went to one of the major medical institutions there. And, they put him on medications, but the medications did nothing for him. He was still
anti-seizure meds, just stuff to slow everything down. And,
yeah. So he was on a lot of anti-seizure medications, but he was also on lots of high doses of benzos. And I'm like, my goodness, he was really on a lot. So when I did his results, he actually had positive for Sears. He was really a Sears patient. And I really thought, did this Sears really induce a Tourette's type thing? I've seen Sears, for people with dementia, people with ALS, people with all kinds of different things. But, that was my actually first Tourette's patient that actually was positive for Sears. And so I thought
can you kind of define Sears for everyone? Because
so Sears is chronic inflammatory response syndrome. And chronic inflammatory response syndrome usually happens because of biotoxins. Toxins put off by biological organisms like mold, mycotoxins. But you can have Sears because of toxins put off by Lyme and by other Babesia, Bartonella, you name it. You can have those toxins. All those things are going to put off some type of toxin. So he actually had a mold exposure, not realizing it.
One thought is that I think the combination of stress, a chronic infection, and then a toxin.
Mm-hmm.
So I think there's often an underlying infection.
Well, he had high Epstein-Barr titers too. His Lyme was negative, but he had high Epstein-Barr. And I was surprised. He's from Alabama. I was surprised he was negative. He was one of my first Alabama patients that was negative for Lyme.
But there's no Lyme in Alabama.
Yeah, right. There's no Lyme in Florida either.
Yeah.
So, for him, his TGIF was 32,000.
Wow.
2,000 TGIF.
Tons of inflammation. His brain was just inflamed.
Yeah, his brain was inflamed. So, Vibrant of America has something called a neurozoomer.
Oh, so I was going to ask you that because, I didn't recognize the name of the company. Yeah, neurozoomer. How do you like that compared to the other PANS test?
Well, I use the PANS test too, so I can't say that I use one or the other more, but I do the PANS test too because I belong to that society.
So you want to take on everything, man.
So I like them both, but this one just seems that it hits a few more. So he had some antibodies to some things that really were key and instrumental for the anticholinergic things. He had antibodies for the blood-brain barrier. He had a lot of inflammation in the brain, basically.
Yeah.
So because of his inflammation in the brain, I said, we've got to pull your inflammation down. It's got to be number one. So, and naturally for the brain, you're going to need fats, right? So, one of the first things I do is start IV phosphatidylcholine on them. And, but I also I did something. I said, you know what? I want you to get this fast. So I want you to know this is kind of my first trial of doing this. So my first trial of doing it is I filtered out thymosin alpha-1 and I put it through a filter. And I actually gave him thymosin alpha-1 through IV.
Okay.
But I filtered it.
Yeah. No, hey, we do the peptides and some studies like it's in thymosin beta-4 in TB4 frag is actually a much smaller and across the blood-brain better.
Yeah.
Better and suppressing microglial activation.
Yeah, the microglial activation is key in a series.
Just brain on fire.
Yeah. Yeah. And that's basically what I had, was a brain on fire. I started giving him the thymosin alpha 1. He was on BPC 157 because he had gut inflammation too. And of course, BPC 157 I love for everybody anyway.
Yeah.
So I just make it just works for everybody. So he was on that. We did do TB4 on him as well. And I did do decellularized growth factors on him, which are great. They're great anti-inflammatory. They do cross the blood-brain barrier pretty well, and really brought a result for him. But he does come down every 3 months and just do a little bit of a tune-up with me.
Did he stop having Tourette's?
Yes. Yes.
You should write that in a journal. I mean, you should, right?
Yeah. Well, I'm in the process of writing his.
Are there any cases of that? I
don't know. He was diagnosed with Tourette's, but I'm like, did he truly have Tourette's? I don't know. Was it really more of the Sears neuroinflammation?
Oh, he didn't really have that. He just likes to scream and cuss at people.
Right. Exactly. I mean, his kids really loved it, and he went back to doing his artwork too. He was an artist. He loved to go back to doing his artwork. So it did take me a long while to get his TGIF beta down and his natural killer cells up. He didn't have any natural killer cells.
And so you used melanotan, I think you said?
Yes, I used melanotan on him as well.
Can you talk about melanocortins?
Well, I love that because it's a melanocortin, and as you know, that's helps with neurological. So, and it helps with, a lot of people think it's just basically for the ghrelin system, but there's evidence that it really helps with serotonin uptake, and it helps with a neuromodulation. So that's why I like that melanocortin system, because it's so key in the circuitry of the neurons. So the neurons really respond to the melanocortin system.
Yeah. And again, we're KPV, which is a fragment of that, coming out. It's more potent and very anti-inflammatory. But yeah, the melanotan, known as the Barbie doll, because you get weight loss, increased libido, and you get tan.
Yeah.
I found it's great for younger people, but if you're older, then you get like dark spots and
right.
That. And I actually tried it. I'm like, this isn't where I'm very ADD. This is working into more and more. All of a sudden, I am just so dark. I'm like some strange, like, I don't know from what continent or whatever, but I'm like, oh my God,
Yeah.
But, and that's kind of a problem. With like PT141,
right.
or erectile dysfunction, that, it's another melanocortin, which can cause some skin darkening, which is a little bit's good, but in older people, like, dark spots and stuff.
Yeah, especially if you're Irish, you don't want to.
Yeah. So the KPV, again, is just the tripeptide, has all the anti-inflammatory, but doesn't have the melanocyte stimulating, so you don't get the skin pigmentation.
Yes, that's great product. Great product. And it crosses the blood-brain barrier much better too, because it's a smaller fragment.
Yeah. And for mast cell, which is such a big problem,
Mast cells are horrible. We have so many people with mast cell issues today. It's just become a huge issue. And I don't see too many people addressing the mast cell issue, yet. But
it's all the nerds on the mast cell mastermind.
Yeah.
But they're still going after the direct. And I'm like, look upstream.
Yeah.
Look upstream and modulate the immune system, and you're going to, fix it. And also, corticotropin releasing hormone.
Yes.
A huge mast cell stimulator. So, if they have high ACTH, you want to give a little bit of cortisol, not a ton, not, not prednisone or anything, but just bring that ACTH down, which will lower that CRH. But
right.
It's mast cells are huge. And even my girlfriend ended up like all of a sudden got dermatographia.
Oh, really?
And it's like, she didn't feel too bad. I'm just like, wait a minute, what's going on? So that's when we called the mold guy in, and
Yeah.
We can't find any mold. And so, but of course, she won't listen to me, whatever, do this test, so, it's a standard to any other doctors in my office because God forbid she listens to me. But yeah, it was crazy,
Right, right. Yeah, and dermatographia, that's a mast cell issue right away. So she has way too much.
I do love that when you have a new patient and all of a sudden, let me just do, and you take a pen and you do that, it flares up and they're like, oh my God, what? It's, 'cause it's so common. Yeah.
It's very common anymore. And so that's why you have to, you really have to address that melanocortin system. But the melanocortin system really helps with a lot of these issues, with neurological issues, of course, because it does, happen, neurologically. So that's why I like the central nervous system and the hypothalamic issues with that are kind of key.
That's like everything.
Yes.
And it's like inflammation of the hypothalamus, you get diabetes, cause all the insulin resistance and, and of the brain, you get depression and anxiety and sleep disorders and pain, all of that.
Exactly. So, and that's what, and you know what, you address that, you address the hypothalamus, these people with the pain syndromes, it really helps them a lot.
Yeah.
So,
Well, and I did a review on HPA axis dysfunction and chronic fatigue syndrome, and they found I think chronic fatigue syndrome and fibromyalgia do a disservice to people because,
right.
like, press on, 11, 18 tender points, which they have nothing special about those tender points.
No.
The rheumatologist take like 20 minutes to do it. It's like, you have muscle pain? Okay. You have sleep disorder? Yeah. You got fatigue? Okay. You got fibromyalgia. And then compared to chronic fatigue syndrome, which is symptom based,
Right.
And they found the difference though was that the fibromyalgia patients had inflammation in the hypothalamus, while the chronic fatigue syndrome more in the pituitary. So, which makes sense, pain center and the hypothalamus, and
right.
so you fix that, and also it was like 57%, no more than that, 60-something% of fibromyalgia patients had autoimmunity.
Yes.
Which just shows that it's all immune, all inflammation.
Right. And and they develop autoimmunity in their brain. And so neurological autoimmunity is a real thing that we've got to start addressing and getting it calmed down, because that's why a lot of these people are presenting with neurological issues. And nobody can really pinpoint it because it really doesn't fit any specific category.
And doctors roll their eyes. As soon as they come in and say fibromyalgia or Lyme, the doctors go, oh my God, And I know you probably have this. It's like we have patients crying their first visit, or do the labs and show them on paper.
You're right.
Sick. Oh my God, no one believe me. And, do you really believe me? I'm like, yes, it's right here,
Yes, this is it. I see it right here.
Yeah.
So that's what I love about doing what we do, because, you get it's hard because you have, they're demanding, the patients are demanding. They've been sick forever and they've been neglected and they've been told they're crazy and it's all in their head. I know. I was told that.
They've tried so many things where doctors say it's placebo, but they don't respond to placebo because nothing's worked.
Right. Right. And so, when you help them, it's just worth it, because it just makes it so worthwhile.
Yeah, exactly. That's why it's tough, but go in again the next day.
Yeah. Exactly.
It's awesome. I could see you're just changing so many lives on a daily basis that you're probably like, people are so thankful, like, oh yeah, that's what I do.
Exactly. We have to just train enough other physicians, because I can't treat everybody.
It's true. You're just by yourself?
Yes, I'm just by myself. I kind of would like a PA or nurse practitioner to come in with me at some point here. So we're just recovering a little bit from COVID too. So once we recover a little bit more,
I love seeing my assistant.
Trying to get rid of Elsa. Yes. So yeah.
So awesome. Hey, this has been great. I don't know how long we've been talking, but
Either.
I just
I know what time it is.
love all your information. And you're so humble too.
Oh, thank you. You are too. I love your knowledge base too. It's just like so great. We're gonna have to get together.
Hey, I've been thinking of some things actually while we're talking. Because we're certainly like-minded, and your passion's just amazing.
Oh, thank you. So is yours. I'm glad you're getting the fragments of these things and getting them so that we can actually take them orally and really getting, where we really need to get with these because, the FDA is not going to come against a fragment of something. Very it.
We're trying. I didn't know how much work it'd be and how expensive, but
Yeah.
I wouldn't have done it if I knew. But yeah, I love it. Just like you, it's like researching, which can take so long, but when you find that little nugget, it just makes it. And lose a lot of sleep. I don't have much balance in my life, but I think my tooth just came out that I knocked out in my accident, and I broke my nose. But anyways, so
go back.
Got this from Amazon and glued it in. So yeah,
And you get the dentist.
broken, and the guy screwed it up. So look, like I'm mad. I'm not mad. So but anyway.
You still look good.
Everyone from LA. But awesome. Hey, thank you so much.
Yeah.
Talk to you forever. And thank you for taking the time. I mean, I know so many people pulling out your coat and wanting your attention. So thank you.
You're welcome. You take care.
Thanks for joining us on the Peptides and Longevity podcast. If you enjoyed today's episode, don't forget to subscribe, share, and leave a review. It helps us reach more listeners passionate about optimizing their health. For more insights, resources, and updates, visit our website at www.holtorfmed.com. Together, let's embrace a future of health and vitality. Until next time, stay inspired and keep thriving.